Good morning and good afternoon. It is a pleasure to welcome you to this HCC webinar, The Future Talks. My name is Maisha Hutton and I'm the Executive Director of the Healthy Caribbean Coalition. This is the second webinar in HCC's webinar series on COVID-19 and NCDs in the Caribbean. The webinar series is part of HCC's broader COVID-19 and advocacy and communication strategy and supports the fifth objective around engaging young people as key players in the COVID-19 response. Youth engagement has been a priority for the HCC since our formation over a decade ago. And we've had significant momentum recently with the appointment of our youth technical advisor, Mr. Pierre Cooke Jr., the welcoming of new project personnel who are young people themselves, and we've begun development of our youth engagement strategy. But our work is only just beginning, because what we are trying to do is to contribute to, in our own small way, the cultivation of an army of NCD activists, youth NCD activists, building on and harnessing the tremendous energy we've seen invested by young people all over the globe in other social uprisings, such as the climate strikes, the Black Lives Matter marches across the globe. These inspirational youth-led movements have been undeniable catalysts for transformational change, activated by a collective awakening, frustration, and rage with the state of our planet today and the uncertainty of tomorrow. We need young people. We need them to embrace the NCD movement, recognizing that the crises we are grappling with now, climate change, social injustice, COVID-19, and NCDs, are interrelated challenges which demand multi-stakeholder, multi-sectoral action in which youth are co-creators of a response which shapes the world they will inherit. And so our task is a mammoth one, but as a community we are making progress. At the HCC, central to our commitment to hear young people is to give them a voice to create, own, and drive the NCD agenda. And this includes this webinar, which was conceptualized, planned, and implemented by young people. So I am passing on to the future. You're about to hear from a dynamic group of young panelists, including our very own youth technical advisor. You will have an opportunity to engage with them using the question and answer function where you can type your questions. I now have the pleasure of handing over to Ms. Danielle Walwyn, HCC Advocacy Officer, youth advocate in her own right, as the moderator of this webinar. Thank you, Danielle.
Good morning. Thank you, Maisha. So good morning, good afternoon, and good evening to all. So my name is Danielle Walwyn, and I am the Advocacy Officer at the Healthy Caribbean Coalition, and I'm so pleased to be moderating today's discussion. So in our efforts to build back better, we need to consider the youth's voice and consider the fact that amplifying the voice does not simply mean creating a space for their voices to be heard, but also listening and addressing their needs proactively. So doing this will challenge existing power dynamics in a space or within an organization, but it is critical to engage youth meaningfully, as it will have many benefits for the youth involved, as well as the youth allies. So youth have unique experiences, perspectives, innovative ideas, and creative strategies to bring to the table. Youth, including those living with NCDs, also have health needs and require support systems as they journey through a very demanding environment. And these needs and perspectives need to be considered now and as we venture into the rebuilding stages. So today we will hear from our panelists who represent youth who've had to manage the realities of the COVID-19 pandemic as students, advocates, and as a person living with type 1 diabetes. So throughout COVID, they have had to adopt, adjust, and navigate unique challenges that they will unpack and share today. So in reference to the COVID health legacy, the panelists will also discuss their perspectives on how to strengthen our healthcare systems and engage youth meaningfully in the process. So at this time, I would like to introduce our panelists. Mr. Pierre Cooke, the Healthy Caribbean Coalition's Youth Voices Technical Advisor. Ms. Kerro Knight, 17-year-old student and person living with type 1 diabetes. Mr. Christopher Laurie, Project Assistant of the Barbados Childhood Obesity Prevention Campaign at the Heart and Stroke Foundation of Barbados. Ms. Zuena Perry, PAHO Youth Ambassador and past CARICOM Youth Ambassador 2015 to 2018. And so, welcome panelists, thank you all for being here.
Hi, good morning, thank you for having us. Morning.
Good morning.
Morning all.
Morning. So let's begin by discussing your COVID-19 experiences. So as young people, one of the first few things that we heard was that we needed to check on older adults in our lives, as well as those who may have had an NCD. And so Chris, I imagine that this rings true for you as you had parents living with NCDs. So could you tell us a bit about what that experience was like in the middle of a pandemic?
Right, so exactly as you had stated, I had not a unique experience, but I had a particular experience whereby both of my parents were in multiple layers of vulnerable groups, as was described through COVID. So they're both in the 70+ age range, as well as both living with NCDs. So I think that in the Caribbean context, I don't think it's unique to Barbados specifically. Children are kind of meant to be seen but not heard. And there's a definitive power dynamic as it relates to the parent-to-child relationship. But now, now that they were placed in the vulnerable group, that dynamic flipped in a way. So now I was the one who had to take on the role of caregiver, whereas they would have been my primary providers throughout the course of my life. And now I was having to do all of the kind of household errands. I was having to do all the checks and balances, you know, and seemingly simple things. So stocking up on medication, going for appointments, anything and everything, I became their point of reference and their point of security. So that was it was a very interesting time, a little tenuous, a little turbulent at points, but I think that they really appreciated the effort. And you know, that is something that while that's my relationship to my parents and of my parents in dealing with COVID at this time, I'm sure that other people would have experienced that with older relatives as well, whether that be cousins, aunts, uncles, grandparents, and the list goes on. Because we all, you know, we all have an invested interest in our older relatives, and how we interact with them was very important at this time.
So Chris, you highlight to just one of the layers that some young people would have faced, whether it was their parents or just an auntie or an uncle that they would have been taking care of. So that's one layer. Another layer for a lot of young people is navigating the online schooling system. And so Pierre, as a student at UWI, what was that experience like for you?
Yeah, once again, good morning. I think the student experience kind of forced you to jump into this productive mode because you immediately left. Remember when COVID happened or when we got our first case in Barbados, immediately it was like school shut down. We all went home. We didn't know what was happening next. And the next thing you know was that we were moving to online classes. No conversation about how we were going to adapt to this space, you know, what were the implications, you know, the fact that a global pandemic is happening around the world, the fact that they want us to produce the same way as if there wasn't a pandemic happening in the world. And it kind of, you know, it bore on you as a student. And the switch to at-home learning was a long and arduous process. Most days you didn't have the motivation to pick up a book. I mean, you were looking at the news and, you know, the constant images and numbers of death tolls rising, you know, there's no hope for the future. We don't know when we're going to get a vaccine. And as a student, having to deal with this happening around you and also having to be productive in the classroom, it was very, very taxing. Personally, I took a break. I had to detach for about 3 to 4 weeks from the entire system, social media, news, even connecting with friends. I completely detached. And it's because everything was coming at you so quickly. You had to be productive for school. You had to deal with the pandemic. You had to keep yourself safe. You were paranoid about touching anything or talking to anyone or just not getting in touch with COVID. And I think it was very, very stressful. And moving forward, when we interacted with teachers, when we went into that online learning space, many teachers just went into teaching as if, you know, this wasn't happening around us. There's no question about how are you feeling? How is this affecting you? What is your mental state? Is there any way we can help you? and the level of productivity that was expected went beyond what would have been the case in a classroom. And I think some teachers kind of took for granted the fact that, you know, being at home doesn't mean you have unlimited time or means that you are available at any time to just sit and do assignments. You are still adapting to a global pandemic, much like anyone else in the world. But I think everyone believed that, you know, as a young person, since we already spend most of our time on social media, it's easy for us to just go online and learn. It's easy for us to just interact in that space. It wasn't. It was very, very difficult, very, very challenging. You know, you had to deal with parents who were stressed, whether it's because they weren't at work anymore, whether it's the fact that they had to cope with COVID-19 as well. And I think teachers as well would have been stressed in some instances because they have to deal with the pandemic and they also have to continue teaching. So it's that sensitization or education about mental health that was needed within that space so that they could more comprehensively or better restart teaching and the learning process, because many students weren't as productive as they normally would be. And even going into exams, we couldn't be as productive as we normally would be because we had no time to breathe, to actually take note of everything that was happening and cater to our mental health. So it was very, very stressful going through that process.
Yes, so Pierre, so you've highlighted that, you know, there were some stressors, there were expectations, maybe unrealistic expectations, and just navigating all of that with this new norm that we're adopting to. And you highlight mental health and the need to better support within a mental health sphere. And so Zuena, I know that as a PAHO Youth Ambassador, you were part of facilitating some of these COVID-19 chats on a weekly basis with regional and international youth, and you would have created a space where they could share some of their experience during the pandemic. And so maybe you could share some of those like general experiences that some of the persons may have had, as well as yours.
Hi everyone. Yeah, so as part of the PAHO Youth for Health, we've been hosting the COVID-19 Youth Hangouts, which is a weekly hangout every Wednesday on WebEx. And we cover a whole range of topics. We look at your mental health, we covered sexual health and reproduction, because let's face it, there are a lot of people who may be engaging in some other activities out of boredom or just don't have anything else to do. We don't know, but we want to make sure you're doing it in a safe environment, because the added pressures that Pierre talked about as a youth, it gets to you. So people have been looking to relieve stress. They've been looking to have pent-up energy. As youth, we are a very active group. We are probably one of the more active groups, probably next to toddlers, who I don't know where they get their energy from, but we've adapted it, and we usually take it in the form of going out, and we're very social, and we talk to people, we hug our friends, even something as simple as hugging the friend. You couldn't do that anymore. So now that's a change in how we greet one another. So some people felt isolated, even if they weren't isolated. And then we had persons who are sharing households. So before, you know, interaction with your family may have been when you're in the morning before you go to school or go to work, and then you come back in the afternoon, you spend some time there, then you go out with your friends again. So now you're in an environment where you are constantly in one location. So now you have this pressure, this mental pressure now to interact with the same people all the time. You can't go anywhere, so you're limited in your choices. The movement you would have had before, so you're feeling constrained. So mentally, it's taken a lot of toll on our youth, because they're expected, as Pierre was saying, to act the same, as if nothing's going on around us, as if the world didn't have this big crisis. And then, as Christopher was saying, we have persons now who are taking on additional responsibilities that they may not have had before, because although the country in Barbados is opening back up, parents are going to work, but the kids are still not in school. So now the older children within the household, or the older youth, they're the ones that are now taking on responsibilities that parents would have had before. We're doing online learning, which is not as engaging as if you're in a physical environment. So now you have to keep yourself entertained. I know many people who may be just watching the most action-packed show in the world and they drop to sleep. So you can imagine now we're sitting down in front of a computer 3 hours straight, trying to take in information as if we're in a classroom. And it's not feasible to expect that it's going to be normal. So we have to make changes for those mental tics that are occurring, because it is a tick. It's getting at us, and it's chipping. And some people don't cope very well because they don't have an environment that welcomes them to cope. There's no one to give a verbal release. There is no physical release because you can't go outside. Some people are trying exercising at home. Some people have gotten into baking. But what about the persons that don't have those resources, don't have the space or the privacy to want to exercise? So we've been facing a lot of new mental challenges. And what we've done is we've tried to create a space where people can come and talk about that. How are you coping at home? How are you doing? It's also an opportunity to meet new people because we miss that socialization. So having an outlet. I found people have been journaling more. So they're writing down how they feel throughout the day. They're taking stock of their feelings. And that's the kind of thing we need to do right now. We need to be aware of ourselves, check in with ourselves and check in with others as well.
Absolutely. And so, Zuena, you mentioned quite a number of things that are affecting youth, adding layers and layers and layers. And one of the things was this mental strain. And Kerro, your experience is unique in that you're a student, you are living in the middle of a pandemic, and you have type 1 diabetes. So what was it like navigating all those layers and still managing your type 1 diabetes?
Okay, well, good morning. As a type 1 diabetic, it was really rough, but it was especially as rough as a student as well because, well, this COVID situation had put us at a disadvantage. As Pierre said, you weren't really prepared for the pace that you now had to go at and the lack of productivity. And you also had to cope with keeping up with different assignments because, you know, each time you do an assignment, there's another email coming in for you to do another assignment. And as a diabetic, that was also rough for me because I was risking my sleep to finish these assignments because, you know, you have due dates to meet. And this caused my diet to change, my sleep schedule, because I'd be up after 3 in the morning trying to finish my assignments, which would then cause me to wake up late the next day, and that would alter my eating habits. And that had a very, very negative effect on my sugars. Also, this COVID situation had put a damper on my appointments. So I wasn't able to have my clinic visits with my doctor. And it also put a delay on my testing that I had to do, you know, to check up on my progress as a diabetic. And with all of those delays, it really did affect me mentally, like Zuena was saying, because the space that you're in, you're not really accustomed to being in that space. And you can't function knowing all of this is going on. So it really put a damper, not only on my health, but also on my academics.
Thank you, Kerro. So from everyone's experiences, we're hearing different things. We're also hearing some similarities. And so at this point, I'd actually like to open up a poll for our webinar attendees and just ask you some of the experiences that our panelists have shared so far. Can you relate to them? Numbers are coming in. And so far we're seeing 100% that yes, our attendees, whether youth or youth allies, have experienced something that at least one of the panelists have touched on. Okay. So I think it's important to note that, you know, there's a chance that we wouldn't have known these things if we had not asked the youth what they were going through. And so this reiterates how important it is to have youth be a part of our conversations now and as we build back, okay? And so thankfully, we're not starting from scratch, and that youth engagement and involvement in the NCD arena isn't anything new. And some of our panelists are a testament to this. So Pierre, our Youth Voices Technical Advisor, you have represented HCC on a regional scale as well as on, you know, international stages. What has youth engagement looked like in those spaces?
Okay, it's very interesting because as a youth advocate or someone who has been in youth spaces or spaces that are supposed to enable youth for quite a number of years, you tend to grow cynical about approaching these spaces because you think that your participation is more symbolic than it is meaningful. And actually, my interaction with the Healthy Caribbean Coalition has been, I think, the best to date in terms of meaningful youth engagement. Youth engagement has always been part and parcel of my package, whether it is nothing for us without us, nothing for the youth without the youth, or any variation of that phrase. I've always believed that if there's anything affecting young people, you should have a conversation with those persons who are being affected. Participation should not be symbolic, it should be meaningful. And I think more and more organizations, CSOs, youth groups need to understand what meaningful youth engagement looks like. With the Healthy Caribbean Coalition, I feel authentically involved, not only in the developmental strategies, but further in the implementation, the monitoring, and the evaluation. And I think most times, young persons are engaged in the development. What are your ideas? You can just submit them here and we'll work on it. But in the monitoring, the implementation, the evaluation, we're left out. And if you want to meaningfully engage those youth voices, those are the things you have to do. Some of the best practices that I've seen in this space in terms of engaging youth meaningfully, and I think our audience can benefit from, is building the capacity of the young persons that you're engaging with. If you want to speak on a matter or speak on a topic, ensure that they have enough access to information and they're trained in the way to disseminate or share this information. You need to involve your key stakeholders at every level. It encourages commitment. You want to work with the group. You feel passionate about working with the group. You feel welcomed. I feel welcome within my space because you're engaged and you're meaningfully engaged so much. Youth being engaged in your strategies translate to context-specific solutions to youth issues. Kerro just spoke about her experience with education during the COVID pandemic. Having her in this space and understanding what the person living with NCDs goes through or went through during that period, persons listening to the webinar can now create context-specific solutions to deal with other persons who are living with NCDs within that same space or within future pandemics or health issues. And the NCD advocacy movement needs young people because I believe we are the most powerful and passionate advocates that they have right now. We're fearless, we're brave, we're not afraid to tell people, you know what, we want this and we need it to happen now. And we speak up and we speak out. And if you want that type of engagement, that type of passion, that type of drive, you need to make sure that the young persons within your sphere feel comfortable. They have the capability, you build their capacity and ensure that it's a long-term process and not just a single inclusion for the looks of it or just to tick a box. But meaningful engagement has to be meaningful. It has to mean something to you and to the young persons you are engaging with, yeah?
That's fantastic, Pierre. And the emphasis on it being not just at one stage of the process, especially if you're involved in programming, but have it be, this is long-term. So if you want these to be involved, this is a long-term investment commitment to the youth, for the youth. And so Pierre, I also know, so Barbados is home for you. And I know that you're involved in a number of local initiatives, including the Barbados Childhood Obesity Prevention Youth Subcommittee, which Christopher leads. And so Chris, I think, Pierre has connected it so nicely in that some key things that, initiatives and organizations should be doing to allow youth to feel empowered. And I feel like I see those things in the Youth Subcommittee and other Heart and Stroke Foundation projects. So maybe you can give us an overview of what those look like.
Sure. So thank you, Pierre, for just explaining my entire job to the audience. But truthfully, what Pierre said is every bit as applicable now in today's context through COVID. As I was thinking about the whole conversation last night, I was thinking about that kind of meaningful youth engagement very specifically. And as Pierre attested to, part of what the Heart and Stroke Foundation is invested in is a national campaign to combat childhood obesity, looking at the kind of obesogenic environments facilitated in the school system specifically, but also in the general public. So whether it be non-nutritious foods or beverages, we're looking to directly address the access to those items in the schools. We're looking to educate all stakeholders within the environment, and that is inclusive of students, but also their parents, the teachers and staff, and for the vendors as well. And you know, we always have consultations with each of these groups, and try to always engage them and take their input on board. It doesn't make any sense to try to project an initiative onto a group of persons or individuals without them having stakeholder buy-in, because the plans will fall through. And from my personal background in research, one of the things which I was trained in is participatory action research. And that exists in a cyclical process. So if you think of a coil that just goes around and comes back in on itself, that is exactly what Pierre was referring to, that you have to, at every point in every action that you make, and every time you take 2 steps forward, you have to take that 1 step back and ask whoever you are purporting to target, whoever you're purporting to address and to help. You have to ask, okay, well, how did you react to this? How did you feel about this action? How did you feel about this policy implementation? Whatever it may be. And to just keep them involved in the conversation at every step. So from the planning to the conceptualization, to the implementation, to the monitoring, to the follow-up, to the output of the report, whatever it may be, you have to be of service and in service of your target group. And I think, you know, that is so applicable, not just in the health space, but across all borders. And, you know, we always put a prime on external consultants when you have all of your answers right in front of you. So if you're trying to help, if you're trying to engage a particular target audience, why not engage them in it? Like, you know, you're shooting yourself in the foot, as it were, if you do not have them as part of the conversation.
Excellent, thank you, Chris. So again, we're hearing that you need, if you really do want to engage youth, they need to be part of that conversation. And so, Duena, you're currently a PAHO Youth Ambassador, and you were a past CARICOM Youth Ambassador. And so at these higher level meetings, programs, engagements, what does meaningful youth engagement look like there? And just maybe you can give an overview of what meaningful youth engagement looks like in those spaces.
Yes, so at that level where we are talking about governmental involvement of youth participation, it's really, they are making concessions for us to have a voice. We are invited to the meetings, we have an opportunity to talk, we are involved in the process. And what Pierre wanted, which was going from beginning to end, conception to execution to evaluation, we are a part of that process. They give us that opportunity. We as a youth, we also have to meet them halfway as well. We need to be able to say, well, this is what we want. So it starts with us being informed about our own issues. It starts with us being proactive as well, because the one thing I've learned being at that kind of high level meeting is that there's a lot of bureaucracy that goes with it. And so when we, the youth, are saying these are the issues we have now, they're like, yes, these are the issues we have now. But for us to take it from talking to you about it to becoming an action plan, there are steps that we have to follow. So that's why I truly love grassroots organizations, because they get past some of that bureaucracy and they're able to go directly to the youth where they are. And for me, the meaningful involvement means that we have to get involved. We have to get our hands dirty, so to speak. We have to be able to go to the youth where they are. A lot of the times programs have, such as the CARICOM Youth Ambassadors here in Barbados, we have faced some criticism because people like to say that's for the college educated. But the reality is the program's open to all and everybody. So if you're interested in it, you have to be about it. You also have to be in the playing field. It's like the lotto. You have to be in it to win it. You have to be in it to make change, right? And a lot of our youth, I like this generation that we have now. We're that generation that says we're about action and we take it and we do it. So for us, we're utilizing the avenues that are available to us. We're using social media. We have our friends, we're using WhatsApp, we're going out into the street. For me, I teach with not just one, but two organizations, which is the Agonar Program Barbados and also Sports for Life Barbados. And that's getting into the community. It's going out and not sitting down saying, well, I see what the issues are because I live it, and my experience might not be everybody else's experience. So if you want to go to those high-level meetings and be the voice of the youth that we're supposed to be, because we can't just talk about our experience. We have to go out there, we have to find what other people are experiencing. We have to look at it holistically. So yes, I have educated college friends, but I also have the friends that never graduated high school or secondary school. I know people that sit on the block. I know what their issues are. I know what the unemployment issues are because I have friends who are employed and unemployed and in that transitional period of being an entrepreneur. So I know what their issues are and talk to them about it. So I'm able to represent a well-rounded representation of our Caribbean youth, which, by the way, we make up 66% of this population in the region. So we need to have that voice. So meaningful involvement means meeting the government agencies halfway. We bring our knowledge and expertise, and then we take their resources and we kind of marry them together to get that work going and just bring change. That's all we want. We want change, and we're the generation to bring it.
Excellent. And so if everyone's following, we've heard that, yes, youth need to feel supported, empowered in particular environments, but also youth, we have a role too to step up and say that this is what we want. We need to be informed, engage in those different capacity building exercises. So it's a two-way street. We're both involved here. Kerro, so I'm going to turn it to you. You were a high school student just last year. And so I'd be very interested to hear about the tools or resources that you would have liked to see in a school environment to really help youth feel more empowered in an advocacy space.
Okay, so as a young person living with a non-communicable disease, I think it's really important for awareness to be brought to not only diabetes, but other non-communicable diseases, because in a high school environment, you'd be surprised as to how many people are suffering a certain disease, but the support isn't there, so they keep it to themselves. And so with that struggle, I think it's really important for groups to be formed, whether it be at primary level, secondary, even tertiary level, where these health leadership groups could be established. So you could form this form of community amongst students where you could learn about a particular health condition, or that group could just be there for support. You don't have to have the particular disease or condition, but you could just be there because you want to find out more about it. You could just want to bring awareness because non-communicable diseases are becoming really, really popular, especially in young people, even though it's not something being talked about that much. And forming a group within school could really be a good foundation, especially starting at the primary level, because when you're diagnosed as a teen, you miss out on a lot. So by starting at a young age, such as the primary level, you could really implement this sense of awareness and support at a young age. So as they grow, they could have that sense of, okay, identity when it comes to their sickness, or you could already be supportive to different diseases. So as you meet people, you're able to connect with them. So by having these groups, I think that you're not only teaching them about the particular disease, but you're helping them relate to the patients, and they're able to form that community of support.
Excellent. So from that discussion so far, we've heard that there are opportunities for meaningful youth engagement existing. And whether it's grassroots at a government level and just internationally. And then Kerro, you've brought in the point that perhaps this youth health advocacy needs to start at a young age. And you're suggesting even primary school to really start, one, supporting young people who might be living with NCDs, but also young people, just to create a more supportive culture. So we're taking note of that. And so far we've heard experiences of our youth during COVID, opportunities for youth engagement right now, and strategies that we can use to build back better. And so now we're gonna shift the conversation a little bit and really discuss the COVID-19 health legacy and the panel's perspectives on how we can build back better. And so the urgency to build back better within the NCD arena is intensified by global targets that are set by the WHO, as well as the United Nations and their Sustainable Development Goals. And so one thing is that universal health coverage is central in achieving the health-related Sustainable Development Goals. And primary health care has been considered a cornerstone of universal health coverage. And quality primary care addresses comprehensive as well as interrelated physical, mental, and social health and well-being. So considering all of this, I ask our panelists, we have identified some inefficiencies in our healthcare system as a result of the pandemic. So how can we engage youth and use a multisectoral approach to build back better? And actually, I'm going to start with Zuena on, your position as a mental health advocate. What do you think support for youth, especially mental health support, looks like as we consider building back?
For me, it's two things. We need to have one acknowledgement that it exists, because this is the Caribbean, and for the most part, we say when someone has mental challenges that the bradycardias, the slow, we need to change the terminology around it first. We need to acknowledge that it's a real thing. I think Christopher would have mentioned earlier that we had and still have this ideology that children are to be seen and not heard. So when youth have issues, we don't take it as seriously as we can, which is evident by the fact that a lot of our secondary schools, guidance counselors, there's one guidance counselor to 3 years. And I'm talking 3 years, not 3 classes. That's year 1, year 2, year 3. And then you have the upper school, they have their own a separate guidance counselor, but that's still one person to about 500 people, right? So how do they get the attention that they deserve to deal with their issues? Secondly, it has to be, as you said, a multisectoral approach, just as almost anything that we do with the youth, because youth do not operate on an island alone. They're influenced from other places. So they have their peers, they have their teachers, they have their families, they have the society that they're living in. So we need to have an approach that focuses on creating a system with which they can thrive within. So we have to set it, if it's something as simple as maybe an internship opportunities. The Caribbean isn't big on internship opportunities as it would be if, say, someplace like the US. But giving someone where we live in a society that says, oh, you have to have experience to get the job, and to get the job you have to have that experience. Internship kind of can take away some of that mental stress. Like, okay, I do have some level of experience with this, and we're looking now post-COVID where jobs are going to be, because we're so tourism based that we've lost a lot of jobs here in the Caribbean. So now the market that was already slim before is now even slimmer. So there's a new mental added stress to that. So when we look at our healthcare system, you have to look not just at the services that are available in a hospital, but we have to kind of approach the society to realize, well, the youth that you're seeing now, their challenges are a lot more. They're a lot more stress. There's a lot more pressure. Machinery is taking over. So there's a lot less need for physical in-demand jobs. So how are we adapting our society to the person? So that multisectoral approach is going to be crucial. So first, acknowledge, and then 2, let's work together to build a system that supports a thriving youth network.
Excellent. So Zuena, you started, talking about the fact that we really need to build a conducive environment for our youth to thrive. And so Chris, as a youth advocate and as a child of parents who have NCDs, what does it look like to provide some youth empowerment or engagement opportunities while also still navigating the NCD arena?
So for me, it's a very interesting dynamic of which I'm working in currently. So in my professional sphere, I think everyone on the panel has already attested to the need and to the power of that meaningful youth engagement. And hopefully to the credit of our coalition effort in pushing for childhood obesity prevention and mitigation, we do try to facilitate as much as possible that youth empowerment. So not only do you provide the youth advocates, the people who we work with and who we consult with directly, with the kind of information to be able to speak assertively on XYZ issue, but you also invest in other things which do become applicable when people get on a stage or get in front of a mic. So ideas of public speaking, ideas of self-esteem, ideas of just leadership qualities. I think those soft skills can definitely be honed in on. And again, putting your target audience, putting your target groups, putting your working groups. For us, working in a health space and engaging with youth for youth, those will necessitate the youth by default, and also the people living with NCDs. So again, as I started to allude to before, it's not just about having the kind of technical experts, but also engaging with the people who you are servicing. And if you tie that in with the SDG goals and looking at what universal healthcare means, you want to have equal access for all, but you also have to remember about that equitable access. So youth, as well as people living with a chronic condition, a long-term condition, it's not a homogeneous group. We're not all facing the same kind of experiences. We're not all going to have the same kind of dynamic in accessing healthcare. And there's going to be some level of discomfort that someone might understand better than other, or not in the reverse. So having that understanding, having that engagement, you're not going to have that level of in-depth understanding, as Zuina was speaking to earlier. Like she speaks with all members of society. She tries to get that kind of input from all persons within her circles of influence, and then as an advocate tries to relate that and in a concise and synthetic way, and a synergistic way. But you still have to have that input. And again, putting your target audience at the forefront. So I was thinking last night that when you have a hospital or a clinic setting, you can arguably say that, well, the clinical management team is important because they treat the people coming in. Or you can argue that the administration is important because they run the operations. You can argue that the kind of technical people who service the equipment are important because they support the kind of testing efforts that are needed to run the service. But then sometimes the conversation gets lost with who you're actually serving, and you forget about the people, you forget about the youth, you forget about the NCDs, and you try to project things into this space that are not applicable, and they do not work as efficiently, as effectively as they can, as they should, because it's not people focused, it's not people centric, it's not youth focused, it's not youth centric. Same thing with NCDs. And also acknowledging, as Zuina spoke to earlier, as Kerro shared her personal experience, as Pierre reinforced in that various layers of youth engagement, that you have to have that all-encompassing view. And, you know, until you address the most vulnerable around you, it shows your deficiencies and inefficiencies in everything. Because, you know, if you're not capturing everyone, then you're not really capturing anyone.
Excellent, Chris. And so again, re-emphasizing that the people who you are aiming to provide services for need to be a part of that critical conversation. And so Kerro, you had to experience, you know, managing your type 1 diabetes before COVID and during COVID. What has your experience been like, and what are your suggestions for moving forward?
Okay, well, when it came to managing my diabetes before COVID, it was tough because I've been hospitalized a few times since being diagnosed, and one thing I've realized is the lack of mental support. Now, a doctor would have knowledge on the disease itself, but they never really explain to you what goes beyond the disease. There are many other ways that the disease can affect you mentally, emotionally, psychologically, all of that. And one thing I've realized, they'll sit down and tell you, hey, you have this disease and this is what it is, but they won't tell you in the long run, this is what it will do to you. This is how you will feel. There will be times when you don't understand it. So there are a lot of gaps in that mental preparation when it comes to the disease. I feel like they should adjust information to suit different age groups. Because you have kids who are being diagnosed with different diseases as young as 4, 3, and below that. And it's hard to explain to them with these big words that they have this disease and they're supposed to understand it. So I think that they should try different methods of explaining. So for example, children, for example, 5 years old, they could implement a game that would help them understand their disease better. Or even for children who don't necessarily have the disease, but you want to bring awareness at a young age, you could try making interactive methods where they're able to share with each other, but through an interactive way. You know, they are learning faster and it would be way more effective. I also feel like the use of telemedicine, you know, using mediums such as WhatsApp to communicate with your healthcare provider. Because in this COVID situation, that's one way I've gotten access to healthcare per se. Rather than being with my doctor face to face, I had to use WhatsApp for her to, you know, check in, how are you feeling, what are your sugars like, what problems are you having, and if it's something drastic, then that's when I would have to have an appointment with her face to face. But if it's possible for her to contact me through WhatsApp, that's what we do. And they should also try implementing integrated care. No, as a diabetic, I often have to see a dietitian, I have to see my doctor, and I also have to try to fit in, you know, mental health. Now, I feel like rather than having them individually, they should try to merge them together. So that rather than having individual appointments, putting them together would not only help the patient better understand, okay, this is what I need to do from a broad range rather than focusing on one thing at a time. Because by merging your dietitian, your doctor, you're saying, okay, I need to take this amount of medication to match this diet, but I also need to focus on my mental health. So by merging these different healthcare providers together, you're able to get a better grasp on your health condition rather than with a big question mark on, okay, where do I go next? Because when you're focused on one thing at a time, you're not really remembering what the last person said to you because you're trying to focus on that specific thing in that given moment. So by having these integrated healthcare programs, sessions, whatever you want to call it, it would be way more effective and sufficient for the patient and for the healthcare providers as well.
Thank you, Kerro. So again, we're hearing that, so it just flows so well. So Chris, you made a point to say that, you know, we need to engage youth, and Kerro is telling us as a person living with an NCD, a young person living with NCD, of some of the strategies. And so yes, that might mean having to invest in telemedicine because young people might feel a bit more comfortable in engaging with their physician. And so Kerro, just on a personal note, I know that you have credited the Antigua and Barbuda Diabetes Association with just providing you with so much support during your journey. And Pierre, I imagine that this resonates with you because you are super passionate about youth engagement, but especially within a civil society space. And so just final words from you, Pierre, on what it looks like to engage youth meaningfully and also considering that space.
Yeah, so I think most of this kind of goes back to what I would have said earlier in terms of, you know, how you ensure that your youth advocates feel empowered, are engaged throughout the process, from implementation, evaluation, monitoring, planning, you know, execution, in all these spheres. And if anyone wants more information on that, feel free to send me an email or a message, because I will happily tell you about how you can integrate young persons meaningfully into your systems. But I think where the specific gaps in our engagement lies, where we can help, one is community engagement, where there should be meaningful incorporation and integration of civil society. That should include persons living with NCDs. Kerro gave us a beautiful example of what happens when we can or we do engage persons living with NCDs within our spaces. We now understand what universal health coverage can look like or should look like within a pandemic space. We now understand the needs of persons living with NCDs within an emergency and how we can cater to that. This is specific to us in the Caribbean, where we have periods of, the hurricane season and where access to healthcare can be limited. What do we need to put in place to ensure that these persons still have access to these systems? Teaming up with legal experts and having young persons as a part of the conversation can help to bridge this gap in the community engagement area. There's an investment gap in terms of how do we have young persons advocate for the inclusion of NCDs in national health budgets, or how do we have governments strengthen health systems so that we can be better positioned for pandemics like this one. We need young persons within these spaces because they can add another layer, they can add a unique perspective, and they can add the passion to that voice, to that conversation, to that movement. And we need to increase accountability. Young persons are always there to say, you said you'll do this and you did not do that, and we are here to call you out on it. And in increasing accountability, we can ensure that when persons commit to something or say that they're going to do something, they follow through with it. And those are just areas where young persons can be engaged. And again, if you want conversations about how to meaningfully engage them, feel free to send me an email and we can have a conversation about that.
Excellent. Thank you, Pierre. And so just a quick overview. So we've heard of the unique COVID-19 experience that our youth have had. They have continuously emphasized that, if you want to engage youth meaningfully, they need to be part of the conversation. And that's not just a one-off. That is continuously from beginning to end of whatever program initiative that you are planning, that youth are not, homogeneous group, that they're all different, and so their experiences need to be considered in that way. And youth, yes, the experiences or the opportunities might be provided, but we also need to step up. So that important point from Zuena. And Pierre, your last point on the accountability. So if you're gonna say that you're going to meaningfully engage youth, you're going to do all these different actions, we are here to make sure that there's a follow through. And so at this point, we're going to take some, I know we're close, we're a bit tight on time, but we're going to take one or two questions, and then I want to hear some final words from our panelists. So Chris, I'll pose this one to you. What do you as young people feel that, what as young people feel that you can do specifically in order to improve prevention and control of NCDs?
Well, I think it speaks to Zuena's point, whereby she was alluding to the idea of first educating yourself to be a better advocate. It's very hard to speak or to speak with credibility and authority if you are speaking from an uninformed point. That is not to say that your experience is not valid. It absolutely is. This is a discussion that I have with Pierre all the time, that if it matters to you, it matters. So, don't think that you don't have a voice. Don't think that you don't have insight into it. And you can always speak from your personal unique experience. As we've seen today throughout the panel, everybody shared a different experience of COVID through COVID. But in talking about NCDs and in trying to engage in that space, I would say definitely try to inform yourself, look for simple videos on YouTube. University of YouTube is your friend. And those kind of iconographics, which I think that youth better relate to, gravitate towards, that break it down in a very simple form. And then start to look at the kind of spaces of which are, and organizations that are doing the work. Start to volunteer of your time, start to push yourself into the space. There are a lot of ways that you can carry out advocacy. There are a lot of ways that you can educate yourself. But at some point, you also have to step up and be that voice of change, be that action person. In one of my reflections, I was thinking, that youth have the enthusiasm and the interest, but we don't always have the means or the understanding or the channel. So until those are facilitated, you know, the organizations, policymakers, they should act more so in the role of facilitators versus implementers. So that's how I perceive it. And hopefully, you know, it can kind of change the conversation and change the power dynamic, because youth are creative, youth are adaptive, and, you know, they have the ideas. They're our best resource. They're our best insight into how they feel. We try to push for change. Policymakers will try to push for change, but then if you leave out your stakeholders, it kind of goes nowhere. So that's my little 2 cents.
Excellent, thanks, Chris. And so, Kerro, I'm going to pose this next question to you. So how would you rate the current level of awareness among young people about NCD prevalence and issues related to prevention and management?
Okay, well, as a member of the Antigua and Barbados Diabetes Association, I would say that generally the information is there. Like, you can go anywhere and find information about a particular disease or condition, but when it comes to applying it, that's one of the main issues that we may have. But in aspects to being able to grasp the information or get to it, it's there. So I would rate it at, it's a work in progress. I would say it's a work in progress. Like, you can try your best to, and it's going to be kind of difficult at first trying to grasp a large group, especially with young people, because, you know, young people, they're not going to just listen to something unless it's probably coming from someone in their age group. So I do think it's a work in progress. It's something that we are going to really have to work on, because with time, you know, a lot of things are changing. So you're going to have to try to merge your information in a way that young people are going to want to gravitate towards. So far I can say that yes, you're trying your best to apply the information to young people as best as you can, but we also have to focus on getting that information to them in a way that they're actually going to want to, rather than just, you know, you have them and you're talking to them, they're not going to just really listen. So you can try to form that information in a way where they're going to be interested. So you can try different mediums or things that you see that they're interested in. You try to collaborate information into those mediums and see how far you get.
Excellent. And so, Kerro, you kind of started answering the second question, or the third question I was going to ask, and I was actually going to give to Pierre. We have a question of what other mediums other than social media do you think that can effectively spread the message?
A very interesting question, and I think it kind of changes where my mind was going, especially during the COVID space, because my question has been throughout the entire period, what will youth advocacy look like in a COVID world or beyond a COVID world, where you're at home, where you can't go into physical spaces and have conversations with people? How will you get these persons engaged? I think right now, social media is the best place to meet young people, because you want to reach them where they're at. We're on Twitter, we're on Instagram, not so much on Facebook, but you can find us within these spaces and you can share the messages. We had a webinar today. If you sent out retweets, tweets, and persons retweeted it, young persons on Twitter would have access to this information. So making critical use of the social media space is important. Outside of social media, you want to make use of physical spaces, because if you can't find us on social media, you'll find us within the physical space. Find us within our schools, where we hang out, where we go to socialize, within that environment where we feel comfortable and have those conversations about health, have those conversations on sensitizations, you know, meet the youth where they're at, yeah?
Thank you, Pierre. And so, Zuena, this is a question really looking at the parents. So in targeting youth for various messages, especially at the primary school level, how do you address the need for parental consent regarding interventions that affect their children? So perhaps you can speak to that, but also the need to engage parents in our movement as well.
Well, you just said it yourself, Danielle. It's about engaging the youth, the parents, where they are and about what's going on. Education is very key. We use our youth as the gateway to the parents, because one of the things we find is that with one of the groups I work with, we call a parent-teacher meeting, hardly anyone shows up. So we have to instill in the youth themselves, the kids, the primary school kids. And trust me, there's no one better for advocating on your behalf than a primary school child. If you go home and you're there with their teacher all day, they come home and you try to teach them how to do something separately, they said, but my teacher said. So you have to give them the right tools, and then it's a gateway to talking to the parents themselves. Letters don't work. You need to be more, I find you have to be a more personable approach. You have to become someone that they want to talk to. You don't only talk to them about the bad, which is why a lot of parents have a negative experience in association with teachers, because they find that when they talk to them about their child, it's always your child has done something wrong, as opposed to giving them the positive reassurance that your child is a well-rounded individual. It's not just only the negative. So then they feel more comfortable about wanting to come to you and wanting to get involved in what's going on with their child.
Excellent, thank you, Zarina. And so on that, I know we have some other questions, and we'll be sure to try and get responses to all of you. Oh, we might have one more. So in everything, sorry. Oh, sorry, I may have missed that one, but we will be sure to get the responses to all of you. And you know, just on a final note, I would love for all of our panelists to provide just a key message, one key message for youth during this time before we end on our closing note. So Pierre, I'll start with you.
Brilliant, thank you. And I think kind of what I will say ties into what Michelle was asking within the question box about how would we move forward as young persons to advocate for health issues. And I think one of the things that I'm working on, and I think we're going to work on with the Healthy Caribbean Coalition, is forming a coalition of youth advocates across the region who are passionate, who need access to this information, who want to be a part of the process, but don't know where to find the resources. We can create that safe space where you feel comfortable to reach out to us and say, hey, I need information about how I can advocate for diabetes, how I can advocate for universal health coverage. So within that safe space, we can feel empowered. As I said before, and I'll continue to say, we have the passion, civil society and government have the resources, and when we come together, we have a beautiful collaboration. And once we start there, wonderful things can happen within the health space in the Caribbean and around the world.
Thank you, Pierre. And Zarina, I'll go to you.
I'll keep it simple. Check in with yourself, families. That's all I can say. Just check in with yourself. And that's simply ask yourself, look in the mirror, ask yourself, how do I feel today? And take it one step at a time. Don't put a lot of pressure on yourself. And then when you've checked in with yourself, because you cannot pour from an empty cup, then you check in on other people, right? Because we have to make sure that we're confirming we're not alone. What's occurring to us, the pressures we're feeling, other people may feel. And when you have other people to help you carry the load, it's a lot more manageable. So if I say nothing else that sticks with you, check in, families. That's it, check in.
Thank you, Zarina. And so Chris, I'll head to you for your comment.
All right, so I will piggyback off of what Pierre and Zarina mentioned. I know that one of Pierre's mantras is nothing for us without us. And that's, you know, applicable across any kind of group or stakeholder group or interest group, audience group, whatever. One of the things which I try to live by as well and utilize in all spheres of my life is if it matters to you, it matters. So definitely, as Zarina was talking about just now, you want to check in with yourself, make sure that you are the best person, you are the best resource to carry out this action at this time, but also to ensure that you do not put an undue burden on yourself. You want to educate yourself, you want to empower yourself. And, you know, from what Pierre was talking about, you want to have these safe spaces, you want to be validated that your experience matters, you want to be validated that what you're doing matters. So the idea of accountability, the idea of having that meaningful engagement, it always comes back to it. That kind of cyclical process, make sure that as policymakers, as program implementers, the list goes on, as organizations trying to facilitate change, pushing for change in whatever sphere that you do it, make sure that you check in with the people who you're addressing.
Excellent. Thank you, Chris. And so, Kerro, I'll leave the last word to you before we close.
Okay, well, my message would be to the people with a condition or disease. Find someone that you can relate to, whether it be a friend or a support group or anyone in your age group. Just find someone that you can relate to, and you'd be surprised how much support you get in these empowerment groups. As I said, I'm a part of the Barbados Diabetes Association, and you'd be surprised how much support there is, not only amongst the youth, but generally both youth and the adults. So find someone or a group that you can relate to, because you'll not only have a sense of awareness, but you'll also find the support there as well.
Excellent. Thank you, Kerro, and many thanks to our panelists today. And I would, at this point, hand it over to Maisha for closing comments.
So I am so inspired having seen all of your presentations, and it's just, as I said earlier, the beginning of a movement which we have really worked hard to cultivate over the past few years, and we've seen a steady acceleration, and I'm really proud of what we've seen today. I'd like to thank Danielle for all of her heavy lifting and pulling this together. It was brilliant, really well done. Thank you, Pierre. And behind the scenes, thank you, Carrie Barker, for working closely with this. We have a number of other webinars coming up, which will cover various aspects of our communication strategy. And our next webinar is on July 17th and continues with Youth Voices, where we talk about the legacy. So I urge you all to join us for that webinar. And I think in my closing comment, I just want to say, get involved. You know, look at Pierre we met Pierre just over a year ago, and he's now a global advocate. And I've gone to these meetings globally, and they've said, where's the Caribbean voice? And I said, you know, it's coming, and it's coming. So thanks very much. Have a great evening, the rest of the day, and enjoy your weekend all. Goodbye.